Hello everyone, welcome to my channel. Today we will continue investigation related to eye disorders. Part 1 is in the same playlist before this video. Let's start the remaining investigation related to eye disorders. The investigation procedures in this video will be visual acuity test, intraocular pressure measurement, and retinal examination. Let's start from visual acuity test. In visual acuity test, we detect eye's ability to detect fine details and also eye's ability to focus image at a certain distance. So we basically find out, is the eye able to focus at a certain distance or not. The standard definition of normal visual acuity is 20 by 20 or 6 by 6 vision. This is the distance of focusing by a normal healthy eye. Visual acuity test can be done by using Snellen's chart. Snellen's chart looks somehow like this. Letters spread it apart and the patient is asked to identify the letter one by one. Purpose of this test is to determine eye's ability to focus at a certain distance and then to determine eye's ability to detect fine details about any object, like this letter. Fine detail about these letters. Indications for this test can be refractive error that contains hypermetropia, myopia, astigmatism, and other disorders. Next is blurred vision. Blurred vision can be due to any kind of disease, any kind of eye disease. Problems in peripheral vision, again problem in focusing. And then after surgery related to eye, also we can perform this test. Role of nurse for this test can be, nurse should first of all obtain consent, explain the procedure and make the patient comfortable. Nurse can prepare herself by hand washing and arranging all the equipments needed. Patient should be prepared by the nurse by maintaining correct position and allaying anxiety. Normally, this test is performed by providing patient with a sitting position, and nurse also maintains sitting or standing position. Preparation of environment can be done by adequate lighting and comfort of the patient, as the patient needs to visualize the chart and identify what the nurse is showing. So adequate lighting in the room is very important. Next is intraocular pressure measurement of pressure inside the eye. Measurement of pressure inside the eye can be done by using a device called tonometer. Talking about the fluid inside the eye, there is a constant circulation of fluid inside the eye to maintain its shape and internal consistency. Same fluid pressure can be measured by tonometer. Normal range of intraocular pressure is 10 to 20 mm of Hg. Tonometer looks somehow like this. The purpose is to determine the normal intraocular pressure, to determine the fluid circulation condition inside the eye, and because of that fluid circulation there is maintenance of the shape of the eye, so purpose also becomes to monitor the maintenance of eye shape. Indications for this test can be glaucoma, cataract, and tumor in the eye. As glaucoma is directly related with increase in intraocular pressure, glaucoma becomes the first indication for this test. Role of nurse is somehow same in every procedure. First of all, obtaining consent and then explaining the procedure, explaining the every activities that is done in the procedure, as well as explaining the benefits of the procedure. The nurse should also explain that tonometer might firstly discomfort the patient slightly, but as the procedure advances, there will be no discomfort. Nurse should prepare herself by hand washing and arranging the equipments. Nurse should prepare the patient by maintaining correct position. Correct position for this procedure can be sitting position with neck slightly flexed and allaying anxiety. Nurse can prepare the environment by adequate lighting and comfort for the patient. Retinal examination. Retinal examination is the next examination for us. It includes inspection of fundal part of eye, that is retina. In order to perform this test, pupil is dilated by using a special eye drops. This eye drops enhances the internal view and permits extensive examination of peripheral retina. This means after instilling that eye drop, we can view internal organs, internal parts of the eye clearly and examine peripheral retina, peripheral parts of the retina. The appearance of optic disc and retinal vasculature are also recorded in this examination. As you can see, normal retina looks like this in the fundal examination, and a patient having diabetic retinopathy. Diabetic retinopathy is one of the complications of diabetes. Diabetic retinopathy condition looks somehow like this. Next test is pupil function test. Visual field testing and slit lamp examination. These three tests were mentioned in the previous video. And as I mentioned in the previous video, the diagram for these tests will be shown at the end of second video. So as per my statement, these three are the diagram for those three tests that was mentioned in the previous video. First is for pupil function test. For pupil function test, use a device that flashes the light in the pupil, and pupil function are monitored as per that light. In visual field testing, patient and examiner sits like this. Patient is asked to close one eye, and then the examiner points something or shows something. Patient needs to identify what the examiner is asking or what the examiner is showing. In slit lamp examination, we use slit lamp to examine the internal parts of eye, which gives us the microscopic views of the eye. There is a binocular microscope and there is headrest. In this headrest, patient adjusts the chin and they expose their eye to this slit lamp. Here, a illuminated light source is introduced to the eye in order to examine internal parts of the eye. This was the diagram for slit lamp examination. Thank you so much for watching. This unit will be continued in next video.